Hey everyone, today we're going to talk about a pain that can literally stop you in your tracks. That sharp, nagging ache on the inside of your knee. But here's the thing, we're going to look at it from a completely different angle, digging into a cause you might have never even considered.
So, I want you to just let this question sink in for a minute, because so often the real source of our discomfort is hiding somewhere else entirely. And honestly, this idea is at the heart of everything we're about to cover. If you've ever felt that sharp twinge on the inside of your knee, you know exactly what I'm talking about. It's that super frustrating ache that turns simple things, like running or just climbing a flight of stairs, into these major challenges. It can really mess with your quality of life. All right, so let's play detective. Let's try to solve the mystery of this pain. To find the real source, we first have to get a handle on what's actually happening inside the knee itself. So the technical term for this is medial knee pain. And it's so important to get this. Your knee is not a simple door hinge. No way. It's this incredibly complex and sophisticated joint where three big bones, the tibia, patella, and femur, all come together. And the whole thing is supported by this web of ligaments and cartilage that's under constant stress.
So, when this whole intricate system starts sending out pain signals, what are the usual suspects? Let's start by looking at the culprits inside the knee before we zoom out to see the really big picture.
First up, you could have an MCL strain. This often happens from a sudden pivot or impact that damages that key ligament that keeps your knee stable. Then there's the meniscus, that's your knee's personal shock absorber, which can get really irritated from repetitive twisting or just, general wear and tear. And of course, you can have inflammation from conditions like arthritis, causing swelling, stiffness, and pain. These are the direct, localized issues. And right here, this is the crucial point. This is the moment we need to zoom out. Because if you're only treating the knee, you might just be scratching the surface of the real problem.
And that brings us to a much more holistic way of thinking, a full body alignment approach. It's all about seeing the knee as just one part of a much larger connected system. Okay, this is the key concept right here. I want you to think of your body as a kinetic chain. If your pelvis is tilted or your hips are out of alignment, it creates this incredible domino effect. That imbalance travels all the way down your leg and forces your knee to bear weight unevenly, putting a ton of pressure on those inner knee structures. So yeah, the pain is in your knee, but the problem might actually be starting all the way up in your spine. This really highlights the huge difference in philosophy. The traditional symptom-focused approach, it just offers temporary fixes for the sore knee, ice it, rest it, hope for the best. But the biomechanical approach is all about finding the root cause. It's about correcting that fundamental imbalance in your body to get lasting improvement, not just a quick fix that wears off. So this all sounds good in theory, right? But how do you actually put it into practice? Let's move on to the solution and see how this all builds into a structured, step-by-step recovery plan. It's this comprehensive 5-step protocol. It all starts with a super precise digital X-ray analysis. Then step 2 involves decompression, which gently creates space and relieves pressure in the joint. Step 3 is all about targeted rehab to strengthen those supporting ligaments. Step 4 is absolutely huge. It retrains your brain and your body to ditch those incorrect movement patterns you developed to compensate for the pain. And finally, everything gets integrated into a home care plan to make sure you keep all that progress. And the goal of all of this? It's not just to stop the pain. It's to restore real, confident, pain-free movement that you can count on for the long haul.
And hey, the results really do speak for themselves. Take this experience from Mike T. in Southfield. After just 6 weeks, he wasn't just pain-free, he was able to get back to heavy squatting without that knee caving in. We're talking about a return to full function here.
So what's the biggest takeaway in all of this? Prevention is everything. Here are 5 powerful tips for your long-term health. And notice how they all connect back to the whole body, keeping your spine healthy, strengthening your hips to support your knees, and wearing the right shoes for a stable foundation. It really is all connected.
And that brings us right back to our big question from the beginning. After looking at all this, it seems like the answer is a pretty resounding yes. The next time you feel that twinge in your knee, maybe the first question you should ask isn't what's wrong with my knee, but instead, what's going on with my alignment? Definitely some food for thought.